There are many types of jobs in the medical field that inspires the determination to save lives or help others. But this cannot always be successful without the patient's cooperation. This is a type of video you may come across while journeying through the medical field. This video is meant as a guide for patients who are experiencing surgery for the first time. I hope you enjoy. Hello, I am Andrew Duke Rodriguez, and this outpatient surgery video is made to help you prepare for your surgery day. This will help you understand what to do before the surgery and any surgical procedures, and help reduce any anxiety you might be feeling that has occurred to patients anywhere. The more at ease you are, the better the outcome of the surgery and your recovery as well. 1 week prior to the surgery, you'll be given a pre-surgical day that would help you understand what is to be expected during surgery and will include surgical instructions. These surgical instructions include your date and time of your arrival for your surgery, and also the 3 main factors on what to do before your surgery. You are not to drink or consume food or water 12 hours prior to surgery. You are not to consume aspirin or anything that has aspirin 2 weeks prior to surgery. You must state any medication you're taking and what kinds of allergies that you might have. If these requirements are not met on the day of surgery, the surgery will be canceled, as aspirin can cause excessive bleeding. Food and water can cause vomiting during surgery and causing patients to choke, which can be fatal. On the day of your surgery, you will need to come in at the time you were told to come in at. You will come in and the front office attendant will hand you a questionnaire for you to fill out that includes the 3 key instructions that I mentioned before. After returning the paper to the front office attendant, wait for your name to be called. By then, the surgical attendant will then call you out and escort you to the preparation room. The surgical attendant will review all the information in the questionnaire you answered, where you'll be asked some of the same questions you've already answered, including your name, your birth date, and what kind of surgery you are having, and any other medical information. You will then be instructed on how to put on your clothes for surgery, with their hair cap to cover your hair, feet covers, and a gown. He would also mention a plastic bag where you can put all your belongings and clothing after you change. He will then proceed to leave the room to give you privacy while you are changing. He will then come into your room once again and grab your belongings and put them in their own private locker, which you can get after the surgery. He will proceed to take your temperature, blood pressure, and heart rate. Making sure these things are normal is vital before having your surgical procedure. Once this is done, you will be guided into a surgical room, and a nurse will meet you and greet you and help you on the surgical table. Your vital signs will be taken once again, for this will stay recorded throughout the surgery for the surgical team, which includes the doctor, the nurses, and an anesthesiologist to view. After surgery, you will rest there for a while until the surgical attendant will come in and help you by removing anything that was still connected to you through the monitors. You will then be helped out of the surgical table and into a wheelchair and wheeled back into the surgical preparation room. There, you'll be given back all your clothes and belongings so you can change back into them. Once you are dressed, you will be escorted back into the wheelchair again, so the surgical attendant can wheel you back into the car, or the person that is picking you up and taking you back home after the surgery to continue your recovery. The medical field takes pride in their work, and keeping the patients safe is their greatest concern.